your ego has to be gone. Like if you want to see the most patients and you want to be the best doctor and the very favorite person in the practice, you're not going to build your other providers.
How do you handle that at the front desk? Because I would guess at this point in your career, there are boatload of people calling and saying, I was told to see Dr. Annie. And when they can't, or your schedule doesn't allow it, how have you learned to handle that?
Well, I mean, my front desk was well trained at really encouraging people to take the first provider that they can get in to see. Usually that works. People understand. They're like, and if Dr. Annie's, they always tell them, Dr. Annie is always available to check on your case, check in on you, look over your notes, look over your file. And if they really want to see me, then I'll see them first and refer them to one of my team. But my team is extremely well trained and they're all a little bit different. And so I like to fit personality, number one, really, when I'm bringing in a new patient, like what personality is going to work best with this patient. And so I really sell my doctor team to them. And so it usually is no problem. Sometimes people are insistent, they want to see me. That's how I was referred. And that's no problem. I have space in my schedule for new patients, but I don't keep them.
Okay.
Yeah, as I said, rarely.
Fantastic.
So I think it's around really not having an ego in it and just being able to let that piece go if you want to build your team.
Kudos to you, Annie, because every time I ask a question about how did you handle this, your response is, your team has to be really well trained. It comes down to good training. It comes down to, But one thing it sounds like you have mastered, even long before you found our software, is the role of communication in these things. So many times I think that's the part that gets forgotten in healthcare is communicating, like you're saying, a juicier visit is the reason to add in these additional providers. That everybody on my team can do this, or even if they're not being treated by you, that you communicating the fact that Dr. Annie will still take a look at your case or still review your notes.
Absolutely. And when I hand off a patient too, I tell them the same thing. I'm going to be checking in with you. I'm going to be watching and reviewing your case. And trust-driven care has helped with this immensely. Now we have a communication platform where I can quickly reach out to a patient and communicate and follow up and check in. And same thing with all of my doctors. And that's it's really been great. So thank you.
I appreciate the kudos. It's just, I'll give you another 45 or 50 minutes to talk how much you love us. But in all seriousness, I just think that generally the communication piece is forgotten. I mean, I talk about this. If you look at the classes that are offered professionally, almost always it's ways to improve your treatments, right?
Yes.
And maybe there's some to improve your diagnosis. But the communication side just gets ignored. And I mean, like you do ART or, muscle work. And I think that has the power to explode your clinic if you communicate why it's so important to do that, rather than just jam your thumb into their glue meat or whatever,
Yeah, absolutely. Yeah. I couldn't agree more. And when I hire, just to reflect on that, when I hire a new associate or a new clinician for my office, I hire on personality. I hire on how they communicate with patients. I can train their hands, but I can't train their personality, because that's the key piece of it for me. And, everyone in my office has told a story of their recovery, right? First their repair, then their restore, we're restoring movement and function, and then we're rebuilding them. We're getting their body ready for load. We're loading them, and we're exiting them. And so we communicate the story of their care with us and all the pieces to it, right? This is where athletic trainers are going to come in. This is the et cetera, et cetera, et cetera. So they're clear, their expectations are set. Yeah. So communication is key. Couldn't agree more.
Yeah. I wonder if your previous experiences, you just didn't realize how great you were at that, because the story of how you grew so quickly too, and you were able to bring on people and it sounds almost like there wasn't any speed bumps, and I know there are always speed bumps.
Many speed bumps.
Yeah, but it's amazing how much extra rope a client will give you if you just communicate with them. Like, even when you drop the ball or even when you hurt them or something, and we don't want to do those things, but they just happen, and so making sure you've communicated that it's.
Absolutely. I mean, we're manual therapists, right? I mean, we're going to make someone too sore, too stiff. There's going to be times when we do too much of something, right? In trying to do our best, especially with active release, right? You think you're doing a great job and someone is so sore for 3 days, they never want to see you again. But if you've communicated with it and you've used your trust-driven care platform to say, hey, guess what? You're going to be a little sore in this and this because we did this, right? And just know it and communicate with me next time and then we'll adjust.
Can we dive into, I'm sure some people are listening and thinking, it sounds like everything was puppies and rainbows for Annie. There was just smooth sailing, and she never struggled to make payroll, never had an upset employee, never had an upset client. And it's obvious with what you just said that that's happened. But looking back on your journey to growing, and you've by all measures have an incredibly successful clinic. Looking back, what were two big mistakes you made you wish you could have done it differently?
Well, again, it's been in personnel. It's
Okay.
been the number one mistake I made was in billing.
Okay.
And it was a lot of people's mistake, right? We try to do it ourselves. We try to have a receptionist do our billing, and it's gotten even worse now in my state. The billing it's a full time job for now. I have 3 people on it, right?
It's like the insurance companies are inventing puzzles for you to like figure out.
Yes, let's figure this one out and see if we can get them not paid this way. And so, yeah, my biggest mistake was having my receptionist do my billing, and not because I was just a doc and an ATC. Then I didn't take the time to train her properly.
Okay.
So that cost me a good chunk of change.
Was that just that she didn't have the knowledge to do it? Was it the type of person she was? Like, what was it about that? Overloaded?
Both. No, she
Okay.
was a terrible receptionist anyways.
Oh, good. She made it even worse, Miller.
Yeah, but I mean, back then I was so buried. I was seeing patients, myself on like 100 plus patients a week, doing active release rehab, all this stuff, so busy, and not spending the time to run my practice.
Thanks for tuning in to this episode of Trust Driven Insights, brought to you by Trust Driven Care. Imagine a world where all your patient communication is in one place, seamless, effortless, and on autopilot. That's the power of Trust Driven Care. If you're ready to streamline your practice, check out trustdrivencare.com and see what's possible. Trust Driven Insights, real conversations, smarter care, stronger business.